What if I told you that the patient a doctor just refused to treat could determine whether he ever practices medicine again? This is the story of a physician who forgot the oath he took, and an inspector who saw exactly what happens when doctors think some lives matter less than others. A successful ER doctor who made a terrible assumption. An undercover medical board inspector who witnessed everything. And one decision that cost him more than he could imagine. Stay with me because by the end of this story, you'll understand why assumptions can destroy careers. You'll see what happens when compassion takes a back seat to prejudice. And you might realize that the person you dismiss today could be the one deciding your future tomorrow. This is a story about medical care, human dignity, and consequences that no amount of prestige can erase. Let me take you to St. Augustine Medical Center in Atlanta, Georgia, where one night changed everything. Welcome to Tales of Africa. While you are here, please hit the subscribe button and comment your view on this story and where you are watching from. Let me introduce you to Dr. Kevin Matthews. 39 years old, Johns Hopkins educated, 12 years in emergency medicine. He was good at his job, technically excellent, fast decision maker, could diagnose complex conditions quickly. But somewhere along the way, success had made him selective about who deserved his full attention. If you came into his ER well-dressed, with good insurance, speaking clearly, Dr. Matthews was the doctor everyone wanted. Attentive, thorough, kind. But if you came in looking homeless, smelling of the streets, with Medicaid or no insurance at all, you got a very different version of Dr. Kevin Matthews. The version who made you wait, who ordered minimal tests, who assumed you were drug-seeking or trying to get a warm place to sleep. His colleagues had noticed. A few nurses had complained to administration about how he treated certain patients. But Dr. Matthews always had excuses. The ER is overwhelmed. We have to prioritize real emergencies. These frequent flyers know exactly what to say to manipulate the system. On this particular Thursday night, the ER was moderately busy. Not overwhelmed, just steady. Dr. Matthews had already treated a businessman with chest pain, a teenager with a sports injury, and a young mother whose child had a fever. At 10:47 p.m., a woman walked in through the ER entrance. Her name was Dr. Patricia Okonkwo, but nobody there knew that. What they saw was a black woman in her late 50s, wearing old jeans, a stained jacket, with disheveled hair and dirt on her face. She was limping badly, holding her side, and she looked like she'd been sleeping rough for days. The triage nurse, a kind woman named Maria, immediately brought her to a chair. "What's going on today, ma'am?" "I fell," Patricia said, her voice hoarse. "Few hours ago. Hit my side on some concrete steps. The pain is getting worse, and I'm having trouble breathing." Maria's eyes widened with concern. Trouble breathing after a fall with side pain? That could be a punctured lung, broken ribs, internal bleeding. She quickly took vitals. Blood pressure was slightly low. Respiratory rate elevated. Pulse ox at 94%, lower than normal. "I'm getting you back right away," Maria said, helping Patricia into a wheelchair. She wheeled her to room 4 and immediately went to find the attending physician. Dr. Matthews was at the nurse's station, looking at his phone. "Dr. Matthews, room 4. Female, approximately 55 to 60 years old. Fell several hours ago. Side pain, difficulty breathing, vitals showing." Dr. Matthews looked up and glanced toward room 4. Through the open curtain, he could see Patricia sitting on the examination table, still in her dirty clothes. He sighed heavily. "Another one? Maria, it's almost 11 p.m. You know what this is. She wants a warm bed and some sandwiches. These people come in every night with vague complaints." Maria's face hardened. "Doctor, her respiratory rate is 24 and her O2 sat is 94%. She has genuine symptoms." "Fine," Dr. Matthews said, not moving from his chair. "Give her some Tylenol and a sandwich. Observe her for an hour. She'll leave on her own once she's warm and fed." "Dr. Matthews, she needs to be examined. She could have internal injuries." "Maria," he interrupted, his voice sharp, "I've been doing this for 12 years. I know the difference between a real emergency and someone gaming the system. If she's still here in an hour and her vitals change, page me." Otherwise, handle it. Maria stood there for a moment, furious but powerless. She was a nurse, not a doctor. She couldn't overrule him, but she knew this was wrong. She went back to room 4, her heart heavy. Patricia was holding her side, taking shallow breaths, clearly in significant pain. "The doctor will be with you shortly," Maria lied, hating herself for it. She brought Patricia some water, a warm blanket, and checked her vitals again. Still concerning. Still warranting immediate evaluation. 45 minutes passed. Patricia's pain was worsening. She was pale, sweating, her breathing more labored. Maria paged Dr. Matthews twice. Both times he texted back, "Is she still there? Tell her we can't find anything wrong and she's free to leave." Maria made a decision. She called the shift supervisor and explained the situation. The supervisor was horrified and immediately went to confront Dr. Matthews. While this was happening, Patricia reached into her jacket pocket with a trembling hand. She pulled out a leather credential wallet and placed it on the examination table where Maria could see it. Maria picked it up and opened it. Her eyes went wide. The ID read, "Dr. Patricia Okonkwo, MD, MPH, Senior Inspector, Georgia State Medical Board." Below that was another card, "Emergency Medicine Specialist, 28 years experience." Maria's hand went to her mouth. "Oh my God!" Patricia managed a weak smile. "I conduct random undercover inspections of hospitals. We received multiple complaints about patient discrimination at this facility. I've been documenting everything since I walked in." She winced in pain. "But this injury is real. I actually did fall. And I actually need medical attention now." Maria ran from the room. She found Dr. Matthews and the supervisor arguing in the hallway. "Dr. Matthews," she said, her voice shaking, "you need to see the patient in room 4, right now." Something in her tone made him finally stand up. He walked to room 4, annoyed, prepared to do a cursory exam and discharge her. When he entered, Patricia was lying back on the examination table, her breathing shallow and rapid. Maria handed him the credential wallet without a word. The color drained from Dr. Matthews' face. He looked at the ID, then at Patricia, then back at the ID. "Dr. Okonkwo," he said, his voice barely a whisper. I didn't know." "That's the point," Patricia said, each word clearly painful. "You're not supposed to know. You're supposed to treat every patient with the same standard of care." She took a labored breath. "Now, are you going to examine me? Or should I document that even after revealing my identity, you still refuse to provide treatment?" Dr. Matthews' hands were shaking as he began the examination. Within 3 minutes, he realized how serious her condition was. Severe bruising, possible broken ribs, decreased breath sounds on the left side. "We need a chest X-ray immediately," he said, his voice urgent. "Possible pneumothorax. And a CT scan. Maria, call radiology now." "Should have done that 90 minutes ago," Patricia said quietly. The X-ray confirmed it. Patricia had 3 broken ribs and a partially collapsed lung. She needed immediate intervention. Dr. Matthews inserted a chest tube, a painful procedure she had to endure because he'd made her wait so long that her condition had worsened. As she was being prepared for admission to the hospital, Patricia asked to speak with the hospital administrator. Within 20 minutes, the night administrator arrived, and Patricia explained exactly what had happened. The administrator was horrified. She apologized profusely, but Patricia stopped her. "Don't apologize to me. Apologize to every patient who came before me that Dr. Matthews treated this way. Because I was just one night. How many others were there?" Over the next 2 weeks, while Patricia recovered in the hospital, her own condition serious enough to require a week-long stay, the medical board conducted a full investigation of Dr. Matthews and St. Augustine Medical Center. They pulled his records. They interviewed nurses. They reviewed security footage. They talked to former patients. And what they found was a pattern that went back years. Homeless patients sent away without proper examination. Uninsured patients given minimal care. People of color waiting hours longer than white patients with similar conditions. Medicaid patients prescribed less effective treatments than those with private insurance. Dr. Matthews had been making life-and-death decisions based on how people looked, what insurance they carried, and whether he deemed them worthy of his expertise. The medical board hearing took place 6 weeks later. Dr. Matthews sat with his lawyer, facing a panel that included Dr. Okonkwo, now fully recovered. She read the findings calmly, professionally. Dr. Matthews, we found 18 documented cases over the past 3 years where patients from vulnerable populations received substandard care under your supervision. In 4 of those cases, patients returned to other hospitals with worsened conditions that could have been prevented with proper initial treatment. Dr. Matthews tried to defend himself. I was following protocols. The ER was overwhelmed. I had to make difficult triage decisions. You made discriminatory decisions, Dr. Okonkwo interrupted. Triage is based on medical need, not on whether you approve of a patient's appearance or insurance status. A businessman with chest pain and a homeless woman with chest pain receive the same standard of care. That's not just ethics, Dr. Matthews. That's medicine. The board's decision was unanimous. Dr. Matthews' medical license was suspended for 2 years. To be reinstated, he would need to complete extensive ethics training, work under supervision for 1 year, and undergo regular review. St. Augustine Medical Center was fined and required to implement new patient care protocols and bias training for all staff. Some people thought the punishment was too harsh. Dr. Matthews certainly did. He gave interviews claiming he was a victim, that he'd been set up, that the system was against good doctors trying to manage limited resources. But the nurses who'd watched him for years disagreed. Maria, the triage nurse, spoke to a local news station. This wasn't about one bad night. This was about a pattern of deciding some patients mattered and some didn't. I'm glad someone finally saw it. Dr. Okonkwo returned to her work at the medical board, continuing her undercover inspections. She never revealed which hospitals she'd visit or when, but her presence in the system changed things. Doctors at ERs across Georgia started treating every patient like they might be a board inspector, which meant they treated every patient properly. The irony wasn't lost on her. Doctors were finally providing equal care, not because it was right, but because they were afraid of consequences. But she'd take it. Whatever the motivation, patients were being treated better. 6 months after his suspension, Dr. Matthews reached out to Dr. Okonkwo. He asked if they could meet for coffee. She agreed, curious about what he wanted to say. They met at a quiet cafe near the medical center. Dr. Matthews looked different, humbled, smaller somehow. I've been working as a medical consultant, he said. Can't practice, but I can teach. And I've had a lot of time to think. He looked down at his coffee. I was wrong. Not just that night with you. For years I was wrong. Dr. Okonkwo listened without interrupting. I told myself I was being efficient, he continued, that I was managing resources. But the truth is, I stopped seeing certain patients as people. They became problems to manage instead of humans to heal. He looked up at her. You could have died because I decided you weren't worth my time. I have to live with that. Yes, you do, Dr. Okonkwo said simply. But the question is what you'll do with that knowledge. Dr. Matthews nodded. I'm volunteering at a free clinic now, working with the populations I used to dismiss. And I'm realizing how wrong I was about everything. These people aren't gaming the system. They're trying to survive in a system that's already stacked against them. Dr. Okonkwo stirred her coffee slowly. I don't inspect hospitals because I enjoy catching doctors making mistakes. I do it because healthcare should be a right, not a privilege based on how you look or what's in your wallet. Every person who walks through those ER doors deserves dignity and care. I understand that now, Dr. Matthews said. I just wish I hadn't needed to lose my license to learn it. 2 years later, Dr. Matthews completed his suspension requirements. He returned to emergency medicine, but not at a prestigious hospital. He chose to work at a small county hospital that served primarily uninsured and underinsured patients. His colleagues from St. Augustine were shocked. Why would he choose that? He could have gone back to a top-tier facility. But Dr. Matthews had learned something during his suspension. The patients he'd dismissed, the people he'd considered beneath his skills, they were the ones who needed good doctors most. And treating them well didn't make him less of a physician. It made him more of one. Years later, a young medical student asked Dr. Matthews for advice. "How do you handle difficult patients?" the student asked. "The ones who are demanding or hard to deal with?" Dr. Matthews thought about that question. About a night years ago when he'd judged a patient by her appearance and almost cost her life. About the career he'd nearly destroyed because he forgot why he became a doctor in the first place. "There are no difficult patients," he finally said. "Only patients who are having difficult moments. Your job isn't to judge them. It's to heal them. Every single one of them, regardless of what they're wearing or how they smell or whether they can pay. Because the moment you start deciding who deserves your best care, you stop being a doctor. You become something else." The student nodded, taking notes. She didn't know the story behind those words. She didn't know about Dr. Okonkwo or the suspension or the hard lessons learned. But she heard the conviction in his voice and understood. This was important. Dr. Okonkwo still works for the Georgia Medical Board. She still conducts undercover inspections, appearing at hospitals in various disguises, documenting how patients are really treated when doctors think nobody's watching. She's found more doctors like Matthews. Some have been disciplined. Some have changed. Some have left medicine entirely. But her presence has created a shift. Hospitals are more careful now. Doctors think twice before dismissing a patient. Not because every patient might be an inspector, but because every patient deserves to be treated like they are. If this story touched your heart, remember this. Every person deserves dignity in their most vulnerable moments. When someone comes to a hospital, they're scared, in pain, needing help. That's not the time to judge their worth based on anything except their humanity. Dr. Matthews learned this lesson the hardest way possible, through public shame, license suspension, and career devastation. But he learned it, and in learning it, he became the kind of doctor he should have been all along. Dr. Okonkwo didn't go undercover to ruin careers. She did it to protect patients, to ensure that the oath doctors take to do no harm applies to everyone equally, rich or poor, insured or not, clean or dirty, black or white. Healthcare is a human right. Dignity is not negotiable. And the patient you dismiss today might be the person who changes medicine tomorrow. Or they might just be someone who deserves your best care simply because they're human. That's the real lesson here. Not about inspectors or suspensions. About choosing compassion over convenience. About seeing people when society makes them invisible. About remembering that your worth as a physician isn't measured by who you treat, but by how you treat everyone. Dr. Matthews now teaches this to every medical student he mentors. And he always tells them, the day you stop seeing patients as people is the day you should stop practicing medicine. Because at that point, you're not healing anymore. You're just going through motions. And patients deserve better than that. They all do. Every single one.